Students nowadays build up a tremendous amount of debt, and that debt management is something that I'm not just totally convinced that they're aware of. And there are options for new graduates, but at the American Dental Association, we're looking at trying to lobby for and offer more options for these students to have better repayment plans or better money management so that they can have more options for their future. What we would like to do at the ADA level is to get our members involved, more involved, because if our members were to communicate in volume to their legislators and policymakers, then I think there would be a better understanding of what the situation is, how dire it is as far as student debt obligations, and the many avenues that there are to give them some relief. A good example of giving them a relief right now is the armed services. Not all students are that interested in going to the armed services, but they do have a good program. And I think if that program could be copied nationally, that it would be quite beneficial to our new graduates. There are many testing agencies that sometimes can be confusing to students and sometimes can be a barrier to getting into a practice immediately. And this is something that the ADA would love to address, and right now it is an issue that's on the table. What the solution is, ideally, if a student or a new graduate could get a licensure at the same time that he gets his degree, then he could go move on with his life and not have to worry about waiting around, worrying whether or not he's passed a test from one of the testing agencies. And if that didn't happen, the length of time that it would take to repeat that test in order to get a license to practice dentistry in his or her preferred location. So that's an issue that we would really like to see resolved also. At the ADA and throughout organized dentistry, we've been looking for solutions to access to care for years. I could probably even say for generations. And we have data, we have resources, and we have a workforce. We'd like to utilize this to its fullest capacity, and we'd like for all to know, outside agencies, policymakers, the general public, we'd like for all of them to know just how passionate we are about getting quality dental care to the general public, and that's throughout the nation. The ADA right now is actually extending globally, and the problems extend all over the world. But we feel that we have solutions that work. And I'll single out the Michigan Dental Association as an example. We have a model that works. It's called the Healthy Kids Dental Program. Its primary function, the reason that it works, is that it's fully funded. It allows a practitioner to not only break even, but to have a small profit. We all know that the dental profession donates millions and millions of dollars in dentistry every year. But donated dentistry is not a system. Although it will continue, it's not a system. Our dentists cannot afford to run or not be able to run a small business if they don't have at least a small profit. My objective would be to make a new graduate realize that they need to be a member of organized dentistry, and without organized dentistry, they would be lost. So that would be the approach that I would take, and that's the approach that the full ADA and all of organized dentistry would take too.